Good morning. Today is Thursday, August 20th, 2020. This is Virginia Espino, and I'm interviewing Margarita Loeza for Labor Studies Voces of a Pandemic Story Collection Project. This is a collaborative project between UCLA and Voces Oral History Center at the University of Texas, Austin. So I'm working together with wonderful oral historian Maggie Rivas Rodriguez with Voces Oral History Center. So the collection will be placed online, both housed in their university and on the Digital Public Library of America. So if there's anything that you don't want to answer or talk about, please let me know. I know this is going to be a really, sensitive issue that we're going to be talking about, a lot of emotions, a lot of feelings. So if you need to pause or if you just are done, please let me know.
Okay.
But because we're conducting this interview online, I have to get your verbal consent on the terms. But of course, if you're like, there's things that you don't want to be made public, please say no, you disagree. So I'm going to ask you 6 questions. And if you agree, please say, yes, I agree. If you don't agree, please say, no, I don't agree. And we can move on from there. So labor studies, UCLA Labor Studies wishes, so I work for both labor studies and Chicano studies, but these interviews are being collected through the labor studies minor because I'm looking at mostly people who are essential workers in the pandemic, domestic workers, social workers, healthcare workers, and who are basically whoever else will talk to me and share their story. So Labor Studies wishes to archive your interview along with other photographs if you want to share any photographs or any video that you've taken to document your experience with the pandemic. We'd like to collect those and share those with the Digital Public Library of America and with the Voces Oral History Center at UT Austin.
I asked my son not to walk by.
Oh, okay.
Ricky, I'm on camera, so don't walk by. My teenager just woke up.
I had to put a sign on my door. Oh, interview in process.
So he'll walk by like in just shorts. I'm like, great.
Continuing, UCLA wants to archive whatever photos or video that you want to share, plus this interview in perpetuity. So meaning forever, so that 100 years from now, when people are looking back at this moment, they'll have this information to help inform how they understand this pandemic versus some of the other pandemics that we've experienced. So it'll be made available on the Digital Public Library of America, as well as sometimes UCLA social media might highlight certain clips or certain quotes from you on their platforms, Facebook and Instagram and Twitter.
Okay.
So my first question, do you give UCLA Labor Studies consent to archive your interview and or materials on the Digital Public Library of America?
I do.
Do you grant UCLA Labor Studies right, title, and interest in copyright over the interview and any materials you provide?
Yeah.
Do you agree to allow UCLA Labor Studies and the Digital Public Library of America to post this interview on the internet where it may be viewed by people around the world?
Okay.
Do you grant UCLA Labor Studies consent to share your interview and your materials with Voces Oral History Center at the University of Texas, Austin for inclusion in the Voces of a Pandemic Oral History Mini Project, which will include posting the interview on the internet?
Okay.
Okay, now, did you have a chance to fill out the Qualtrics?
Yeah, I did.
Okay, so that information goes along with your interview. And it will stay private in a secure server at UT Austin. But if you want to make it public, I'm going to ask you about that right now. You can say, yes, I want it to be public, or no, I want it to be private.
I want it to be private because I have a lot of personal information.
A lot of personal information, but it's genealogical. Like, for example, like I mentioned, 100 years from now, that information will be very useful in trying to map out the experiences of Latinos, Latinas during this pandemic. Where are you from? Your high school is going to be important, I think, in the future when we're looking back at this moment. But you don't have to make that public now. Do you wish for us to share? So you say, no, I don't agree. Do you wish for us to share the rest of your interview in your public file available to researchers at Benson Library?
Yeah. Yes.
You do. So that information that you just said you didn't want to be public, it's okay.
For someone in the library doing research, yeah.
Yes. Okay. All right. Perfect. So yes, you agree. On occasion, the UCLA Labor Studies and Voces receives a request from journalists for clips, quotes, etc. Do you give consent for us to share your contact information with them? So say a journalist from the LA Times or the New York Times or the Washington Post is doing a piece. Do you give your consent for your contact information to be shared? Like email? Yes, if you agree. Okay, great. So here we go. So you agreed to all those terms, and I'm going to start with the first question. And this question is just meant to be like an icebreaker. But when I interviewed my friend, she's like, "Oh my God, that's a really heavy question." So I'm rethinking it. But I'd like to start with if there's anything right now that you're doing that brings you joy. If you can talk about something that you do that brings you joy right now.
I guess that is a really hard question. Like, I'm having a hard time answering that. It feels like no. I'm gonna say no.
Okay, and is there anything that I should know about you, your background, anything that you want to tell me before we begin with the formal interview questions?
About my background. Sorry, no, I can't think of anything. No.
Okay, so how do you identify yourself? Latinx, Latina, Hispanic, Chicana?
I guess, well, actually, I don't know how old I am. I think I'm 53. I'm 52 or 53. And I've grown up thinking of myself as Chicana. And now, you know, people are like, oh, it's Latinx. And like the name changes all the time. And then for a while it was Hispanic. But I guess the one I identify with most is Chicana.
Okay, great. And so where are you originally from?
I was born in Santa Monica, California, St. John's Hospital. It's now Providence St. John's. And my mom and dad are from Mexico. My mom is from Jalisco and my dad's from Michoacan. But they met here in Los Angeles. They met in downtown LA. My dad came here when he was 17. He was a bracero. And my mom walked across the border using her sister's green card to get here. But when I was born here, I think at that time my mom got to be a resident because I was born here. And my dad was a resident because he was working here. Because he was
Did they meet here?
Yeah, they met in LA. And I'm the oldest of 5.
That's a whole great other topic that we could interview on.
Yeah.
So at my teaching at UCLA, I have a lot of students whose grandparents were part of the Bracero program, and that's how their family came to live in LA. So where do you live now? Can you tell me about the community that you live in now?
Where I just moved here. I live in West LA, kind of National Sepulveda. I wanted to live close to my clinic, where I work, Venice Family Clinic, and I wanted to live close to UCLA, where I'm faculty there. And before the pandemic, I was almost always at UCLA, so I wanted to be kind of close. And even in West LA, anything like 8 miles away could take hours of the freeway. So I just recently, like 3 years ago, moved here. But prior to that, I lived on Venice and Hauser. My parents owned a duplex apartment building and that they bought when I was in medical school. And I lived there, and it was 4 units, and I lived in 1 unit, and my brothers and sisters still live there. They all have their own unit.
Nice.
So I used to live there for a long time. It was nice to have my brothers and sisters around me.
Yeah. So what is in what do you call your community that you live in? Because I know it's Los Angeles, but like what's the specific?
Westdale. It's I live right by elementary school, and I think it's, you see the sign that says Westdale, but it's like it's near the 10 and the 405. It's, I think it's like west of Westwood Boulevard. So yeah, I kind of grew up in this neighborhood too, but when we were young, we were pushed out pretty much because like the low income housing was going away or being sold, and we were kind of pushed out, and I ended up coming back.
It's nice your parents were able to purchase that property.
Yeah, they were. My mom and dad, I don't know how they did it, but my dad was a gardener for most of his life, and my mom cleaned houses. And somehow, when I was 15, they were able to buy their first home. And then, you know, I don't know how they did it, but they were able to buy 2 apartment buildings and a house. And I mean, we never went anywhere. They never really spent any money, but whatever money they did have, they invested it in property, and they were able to help us out a lot that way. And neither one of them ever went to school, so they didn't even go to elementary school.
That's a whole other interview topic. Because I want to ask you, they should give lessons. You know, they develop some skills that they could really teach other generations to follow on, because that being able to purchase a house with those limited resources is really unusual.
Right, we lived in a 1-bedroom house until I was 15. It was on Olympic and Barrington, and then we moved to Corning Street near the Kaiser West Los Angeles. And my parents, that was their first house. And then when I was 18, I moved to Occidental College. So really, I lived in a 1-bedroom house until I was 15. So, you know, my parents saved that whole time as much money as they could. And then they were able to put a down payment on a house. But they had a hard time buying a house. And I remember their realtor felt it was because they were Mexican. It was hard for him to find them a house. And he was white. So it was really interesting because I overheard him in a conversation with someone else telling them that my parents' bid weren't being accepted because they were Mexican, and he was really mad. Mostly because he was losing money. But yeah, I had that same anxiety when I just bought this house, because I remember my parents' struggles. And even though it's a different time, I still felt that would apply to me. And even when I was outside my house with my brother gardening, this woman came up to us and asked us how much we charge for gardening. And my brother's the nice one. He was so upset, and he was like, "She owns this house. This is her house." And I was teasing him like, you know what? We could have got an extra side job. You should ask how much. You know, I mean, he was like really mad. But it's yeah, I don't know how my parents did it. I mean, I know they didn't spend money on anything. We always ate at home. They didn't buy soda. They, you know, we didn't go on vacations. They didn't buy lots of stuff, things, you know, so we were always saving. So I think, yeah, I don't know how they did it. It was amazing.
That's incredible. So now, if you could tell me or walk me through a typical day in your life before COVID, you know, what would a day, like what would a Thursday look like
So
before COVID?
Thursdays, I used to go to Santa Monica High School teen clinic. So I would just go drop off my kid at Santa Monica High School, and then I would go to my clinic and pick up like birth control pills, condoms, Plan B, supplies. And then I would park near his high school, go into the nurse's office and set up my teen clinic. And I would be there from like 8:30 to 3 o'clock. And I would just see a bunch of kids, either for sports physicals, birth control, pregnancy tests, emergency contraception. I would just see like a ton of kids, barely get 20-30 minutes to eat. We were all packed in a small nurse's office. And then afterwards I would spend my time at meetings or charting, just because I would see 17 to 20 kids, but I would have to put in the data that I took. And then sometimes I would either go to Charles Drew for a faculty meeting, or I would go back to my clinic for a meeting. But basically that's the kind of stuff I would do. And I would get home late and then finish working on the computer, whatever I had to do. you know, that would probably be my Thursdays. They're pretty crazy, pretty busy.
So what's different?
So now Thursdays, the high school has been closed because we had to close the school. So I go to my clinic and I do phone visits or video visits or face-to-face visits. And depending on where we've been in the pandemic, we've had a different percentage of each. Sometimes I would do testing where we have underground testing and I would test people for COVID, or I will do phone visits with people that I can, or video visit, or, you know, a lot of our homeless patients don't have access to phone or videos, so they have to come in, or some things we can't do over the phone or video, so we just have them come in. So it was just a mix. And then I do a lot of meetings with different people regarding our electronic medical record. I'm the chief medical information officer for our clinic. So just a lot of different types of administrative and, you know, lab results, med refills, just different stuff that you have to do. Because even though you do a visit with someone afterwards, you get their labs or their x-rays or something a medication wrote for is not approved. So it's just always on the computer, you know, just a lot of work or on my phone.
Do you remember when you first heard about COVID?
Yeah, it was around January. I think I heard about it. And at first I was following the data and the numbers. And at first I wasn't worried. But then when I realized it was SARS, then I was really scared. And then when I realized, like, I started listening to stuff, I was like, this doesn't sound right. But it's just weird how we get information here. I don't think we get all the information that we need. I just remember, like, when I left the country, like, you know, I remember when I was in Russia and I would watch the news in Russia. It's so different than the news here, or one time, or when I was like in England or Iceland. It's just like we get the news in a different way. So I don't know. I remember seeing it and not being worried about it at first until I realized it was SARS.
So can you tell me where you get your news from?
Right now, I get my news from, I think, like, well, I don't get newspapers anymore because that used to be the way I did it. And now it's just on the internet, any, whatever website I happen to be on, whatever trickles through, that's how I get my news. And sometimes I don't really know what it is. I feel like it's LA Times, Washington Post, CNN, you know, it just whatever's on the thing. And a lot of times the Guardian, sometimes I don't really know where the article comes from until I really like click into it. Sometimes I just read the headline, and depending on the headline, I'll look into it. And then I get the LA County Department of Public Health and the CDC is where I go and look for stuff.
So you said that you didn't think it was that serious, but when did you realize that, or was there a moment that you can say, now I'm worried, now I'm scared?
Early March, I saw this homeless patient, and he had a rash all over his body and it looked like he had pneumonia, and he looked really sick. And we were starting to, you know, try to figure out what to do, you know, with our patients when we were going to close. And I was thinking, I was looking at him and I was like, I don't know what he has, and he might have COVID. And that's when I started, like, that's when I think it was early March when I was starting to get really scared and kind of like worried the most. That's when I started looking at the patients, seeing sick patients.
So when did the best practices protocol change in your clinic?
Probably around March 17th, around there, in middle March, is when they kind of just decided we were going to see less face-to-face patients, when they kind of have to sit down and look at the data and decide. Because when you're a clinic, deciding to close or to change your practice is really hard, and it affects so many things. So I think when in the middle of March is when we decided. And it was also when the Centers of Medi-Cal and Medicare Services decided to pay us for doing telephone and video visits, was also when we were able to switch over, because a lot of our work for years has had to be face-to-face. If you didn't see someone face-to-face, then whatever you did was not paid for. So I could spend hours on the phone with patients and, you know, giving them lab results, refilling their medications, answering their questions. And it didn't count, only the encounters that were face to face. So we were always discouraged from developing telephone visits or video visits. And I had gone to a conference in August of last year, and I sat there and we were thinking about how to do telehealth. And I remember sitting there and the rules were so complicated and so ridiculous. I was like, we're never going to be able to do this and we're not going to get paid. And it was funny because in less than a year, I implemented the telehealth program at my clinic, when I had just sat there in August going, we're never going to be able to do this. And it was like a pandemic was what finally kind of like pushed us over the edge. And we just had to make it happen really fast.
Do you think that if you're going to be able to continue that telehealth moving forward once everything is back to normal, quote unquote normal?
I think that we have to do it, whether we get paid for it or not, to keep people safe. But I don't know how clinics are going to be able to stay open if they don't get paid for the telehealth visits. So we really need to talk to our legislators and, you know, and government officials to make sure that that stays, because it really does help people who don't have transportation and who don't know what to do. And we've always been paid and incentivized to have people come in face to face, and we just can't. We can't have like 60 people waiting in the waiting room coughing, and we can't have, everything can't be a face-to-face visit. I mean, some things are just medication refills. Everything can't come in anymore. I mean, things have to change.
And how do you think that changes the quality of care, moving from face-to-face for non-essential visits to telehealth?
I think I like telehealth, and I actually really like it in a lot of ways, because before I would see someone and I would draw their labs, and then I would say, I'll see you in 3 months for like your diabetes. And I would get their lab results, and a lot of times I wouldn't have time to call them and talk to them about their lab results. So I would just tell the nurse or MA or someone, just like, you know, call them, give them their results. But now I can call them and go over their results, change medication, like go up on this, go down on this, and then I'll call you again in a month. And I feel like I'm able to talk to them more often and make medications for like chronic conditions like diabetes. And what I've been doing with them is I just tell them, weigh yourself. When I call them, how much do you weigh? What's your blood sugar? And our clinic has been giving away blood pressure monitors to patients and teaching them how to use it. So I just have them give me the data when I get on. So I feel in a lot of ways, it's okay to do it for a lot of things, but not for 100% of things. I think video visits have been really good for a lot of stuff too, when I can get the patients on the video. And we just have to work out how to get them to send us pictures of their rashes or different things, you know, and all that technology and implementation of technology and testing it is really difficult and takes a lot of time. And, you know, from what we've done in the last 5 months at our clinic has been, you know, like really good, but it's just not fast enough. You just feel like you need to do more and faster. So it's just that, and then, you know, just some people are going to have to come in face to face because they don't understand on the phone, or they're limited in some way, or they don't have access to the internet. But if we can give some people video and phone visits, then we can have some people face to face, and everybody doesn't have to come in at once. So it could be more controlled.
Yeah, that makes so much sense. So this is kind of going backwards, but can you describe your employer? Who you work for?
Yeah, I work at Venice Family Clinic. I'm a UCLA employee. So it's a federally qualified health center, and I'm a family physician. And I've been working there since 2001. I started volunteering, and then working at the end of 2001, I was working part-time, and then officially started April 2002. Prior to that, I volunteered there when I was in college as a medical assistant. And then prior to that, I was a patient there. My brothers and sisters and I were all patients at the clinic. So I've been at the Venice Family Clinic on and off my entire life.
Wow, that's beautiful. I'm so excited that you agreed to speak with me because this is really a powerful interview. So you already described a lot of your responsibilities. How and you talked a bit about how this pandemic has impacted your work, but can you give me some more details? Has it created longer hours for you? Has it created cut in pay or anything like that?
So luckily we haven't had a cut in pay, and people have donated to our clinic. And because we were able to do telephone visits quickly, we were able to get paid the same as face to face. So that's another thing, is to have parity, to that it would have the same value. Um, I do work more. I used to start clinic at 8:30. Now I start at 8. And so sometimes I get to the clinic at 7 a.m. Um, you kind of can never say no to a Zoom meeting because you're always home. So it's just like one Zoom meeting after another. And then, you're always on the computer, or so I feel like I do work more. And even I took this week off, but like yesterday I got an x-ray result that my patient broke their hand. So I called them and did a phone visit and then did, the whole thing. So it's not like, I just feel like, yeah, I work more because now your work, there's no like a workplace and a home place. They're the same. There's no line. That started a long time ago with electronic medical record where you could bring your charts home. So, but now the line is even, now there is no line. Before there was a little bit of a line, now there's no difference between home and work.
How about like weekend and weekday? Is there a line there?
I think weekends, okay, unless I'm on call or backup call, then, but I do check in the electronic medical record every day, or I try to every day, or I check on my app on my phone, because we have to, if we test someone for COVID, we have to give them the results within 24 hours and report it to, through the CMR, do the reporting. So I can't do that if, if I don't check every day. So, when I do COVID testing, I do have to check every day. And there was a while there where it was taking like 3 weeks. One of my COVID tests took 3 weeks to come back. And there was a while where it was taking an average of 10 days, and which just made the test useless because, there was one woman I tested in July 13th, I think, and I didn't get the result till August 2nd. So, and then, I couldn't find her. And so it's just, yeah, so there is, I guess there's no weekend. I mean, you always have to check your labs. I mean, you can always get someone else to cover you, but it's hard to ask other people to do it.
Right, because
they have the same amount of work.
Yeah, their lines are blurred too. So you said that recently the test took that long to.
Yeah.
Do you have a reason why? Do they give you an explanation, or was that unusual?
No, it's not. It was happening across LA. So they were testing so many people that it was creating a backlog, that they were talking about batch testing. And it's just, and then they started making, and I think we still have it now, where you do priorities. Like if you're in the hospital, you get priority 1. If you're pre-op or you're about to get surgery, priority 2. And the outpatient clinics were more like priority 3. So it's just we were just lower tiered, right? So they were just, we weren't on the front of the line, which makes contact tracing impossible. Like if I test you in the middle of July, and then you get your results in August, and then we're trying to find out where were you 3 weeks ago and where were those people? It's it doesn't work.
No, they've already been in contact with.
Or you're telling them and they're better already. Oh yeah, 3 weeks ago you had COVID.
Right.
Yeah.
That's really frustrating for all of us, because
scary. It's scary, and I don't think people understand how scary it is.
So what messages were you getting from your higher ups back in February and March?
I think that they were like, like all of us, they were just getting the information, trickling in, and you know, getting scared but not knowing what to do. So I remember when I think it was Ebola, we were hearing about it, and we were starting to prepare and talking about PPE, and then it never came, thank God. We had a different president then. And you know, yeah, I hate Trump. I wish he was dead. That could be public. Like, I'm sure there's jail time for that. Yeah, so so it's just people, you know, we were preparing like we did the last time, and we were just talking about it. And I just remember when my friend was telling me, like, we're gonna start playing. I'm like, well, what the hell are we gonna do? We're unarmed. I go, we have no medication, no vaccine. We don't know what the virus does. And I don't know if we have enough PPE. Like, what the hell are we gonna do? Like, it's like you're just going into a fight and you're gonna lose. You know, that's how I felt. Like, you know, it's like, I was like, what are we gonna do? And I go, and if we all get sick, then what are the patients gonna do? It was just like, yeah, I wasn't too positive.
So what was your next move? How did you plan? How did you prepare for this battle?
Well, I feel like, you know, what I always have done since I was a kid is whenever I wanted something or didn't know something, I would just try to read and read and read. And when I was a little kid, I was always at the library. And then, you know, later I was always buying books. And now I'm just on the internet, and I was just reading. I mean, I wouldn't sleep, and I would just read articles, as many as I could, and try to figure out what was going on.
So what was your stance on PPE? Like, what did you feel? What did you feel? So this is like a two-part question. What did you feel you needed as a healthcare provider? And what did you feel community lay people like myself needed to be doing?
Well, I mean, I was very confused because I was watching Italy, and it was super painful to watch. And I was looking at their PPE, and it looked like a spacesuit. And then I was looking at, was it China? And I was looking at their PPE, and it was awesome compared to the US PPE. And I was like, they're getting their, pardon my French, I was like, they're getting their ass kicked. They're dying left and right, and they can't control this. And here we are with like this little yellow plastic gown, and like, you know, and I go, we have like inferior PPE compared to theirs. So how are we going to be okay? I felt like we needed, because I was talking to 3 of the providers at my clinic that go to the homeless shelters and go on the street, and we pulled them back in until we knew what to do. And they were really sad. They wanted to go out and see the patients. And I was like, we can't. We need like a spacesuit like China and Italy have. We can't have the PPE we have here. We need hardcore PPE. And they were like, I go, we have to find a place to get dressed and undressed without contaminating ourselves. And that was kind of like how I felt. And, I just felt we need adequate PPE. My first cousin, he's an emergency medicine doctor. And he was telling me he only gets one N95 mask a shift, and that he gets to change the N95 mask if he intubates someone, but otherwise he doesn't have an N95. He has to have the same one all day, and he works like long shifts. So it's just, I just felt like we didn't have enough, and the ones that we did was not adequate, and because we've never really stockpiled it before. So, and then we had to learn how to put it on and how to take it off correctly.
So what is your typical routine? How do you get dressed for your day at the clinic?
So it just depends on what I'm doing. So if I'm going to see patients right now, I wear a surgical mask and a face shield. And I try to stay, some rooms are smaller than others, and I try to stay like apart from them. And it's not a really good patient interaction because they can't see my face and they can't read my facial expression. And I notice that the more mentally ill and people that are unhoused, because they don't get those visual cues from my face, and they can't see if I'm mad or angry or like happy. They can only see my eyes. I notice that some of them are afraid or like don't feel like they want to tell me something, and I try to tell them that we're going to spend the least amount of time in the room as possible, and then I'll usually follow it up with a phone call to go over what I talked about, because I don't know if when I have my mask and if they even can hear me. And I feel like at the end of the day now, my voice is strained because I feel like I talk so much, and like I have to talk louder on the phone and through my mask. So that's kind of like what I do for the face-to-face. If I'm doing testing, I do the N95, not the surgical mask, and the face shield, and then the plastic gown and gloves. And the same thing, I call them on the phone prior to and tell them what I'm going to do and ask them if they need anything else. And then we test in the garage underground, and it's like open air. And then we just tell them, you know, to go home, and we'll call them with the test result. And we give them like a kit with surgical mask and information sheets on what to do if they have symptoms. So it just depends. And then if I'm in my office, I just wear a surgical mask.
So you said that you are doing testing, and are you doing testing on, or is it mandated that you test each other at the clinic regularly?
No, we don't test each other. We have to go to occupational health for that if we need a test. We have a symptom tracker. So every day we fill out this symptom tracker online. We get a text to remind us, and then we go to the link and we answer the questions. And if we answer positively for any one of those, we're asked to stay home, and then we have to go get a test and then come back.
Have you been worried about testing positive?
Oh yeah, I worry about that all the time. Yeah, I worry about it all the time.
How often do you get tested?
I haven't been tested because I haven't, like, I don't know, I haven't had any symptoms, and I haven't like been exposed or like been, you know, I mean, I've been around people who have COVID because people I've tested have it, but I don't go and get tested. So I haven't been tested yet.
How worried are you for yourself and for your family, considering the work that you're in?
I don't see my family. I haven't gone to anything. Like, I don't, like, birthday parties, Mother's Day. My mom had a birthday. My mom had Mother's Day. I don't go see them. My mom has come to the front of my house, and, you know, I have to keep my child away from her because, you know, I just tell her 6 feet, you know, I just tell him I can't see him, you know. My son graduated from high school, and my family drove by for him. But I don't get near them, because if I am asymptomatic and I am carrying it, I don't want to give it to my family members. So I stay home as much as possible. I order like food online from restaurants or from, you know, delivery service. If I go to a store, it's because I couldn't find it online, and I set a timer on like 15 minutes, you know, like I go in and run out, you know, and it's been really hard. I stay away from my family.
So what's been the hardest about this pandemic for you?
I gained like 22 pounds just from eating so damn much, you know, I think, and eating things like I never ate before, or like, because I used to, I never realized before, but I used to go to the supermarket almost every day and just buy something, like buy fresh same day. And I never realized how many fruits and vegetables I eat. And now I don't do that anymore. So I think that, and for a while there, I had a hard time getting food online in March. In the beginning of March, April, it was really hard to get food. Like, I would try to order it, and I could only order once a week. So I would just buy things that were not so fresh so they would last longer, because I just didn't want to go out.
You mentioned something when we were talking on the phone about you didn't like going out, like even to the beach, because of the way people were behaving. Can you explain what you meant by that?
Well, they're not safe. They're not wearing masks, or if they are, it's like their nose is sticking out, or they're wearing those handkerchiefs, and I don't think those handkerchiefs work, or they're too close. Or like, I remember when I took my son walking, and then this woman was like, wanted to talk to us, and she was really close to us, and I had to keep telling her, stay 6 feet away. And my son was really embarrassed that I was doing that. And I was like, no, I don't, you can talk to her, but she can't get close to you. Like, I don't, so I just rather not go out, because I just don't, a lot of people don't respect the distance. And if they do have a mask, it doesn't cover their face all the way. I even am uncomfortable when I'm seeing patients. A lot of them will start eating in the room or take off their mask or have it. And some of them I've had to tell multiple times, put your mask back on, put your mask back on, cover your mouth. And I remember one, I told them, if you don't keep your mask on, I'm gonna leave this room. And so it's just, that's why I don't go out. It's just so, all that is very uncomfortable. And when I see people doing things that are unsafe, I was walking, and I think it was Memorial Day weekend, and in my neighborhood, I saw a bunch of people like in the front yards hanging out, or a bunch of kids running around without masks. And I was just like, it just makes me so anxious that I just would rather not go out.
So how do you think it's that behavior is caused by our government's response to the pandemic, or just personal lack of fear on an individual level, or do you see it as more of a society issue?
I think, like, I felt like I keep thinking that I always, when I try to answer this, I think about Dr. Fauci when he said, I don't know how to make you care about others. And then I think about Father Greg Boyle, something that they posted, that he said that there's two things that are true if you wear a mask. One is that you're smart, and two is that you care about others. And I feel like fundamentally there is that, that we're, when I'm wearing a cloth mask, it doesn't protect me. I'm protecting other people from me. So if you don't wear a mask, then you don't care about others, and you only care about your comfort and yourself. And so how do you get people to care about others? And like, how do you get people to want everyone to have health insurance or everyone to have housing? So it's just an extension of the problem that we've always had here in this country, where it's more about the I and not about us, or like the group.
How would you rate our governor's response
I think
as a medical professional?
I think he's done well. I feel like he's done more than other governors in other states. I think he's taken it seriously, and he's listening to experts. I know that there's a lot of money involved, and job losses, and housing losses. I mean, it's so hard. So I mean, I think that he's done a good job.
How about our is Garcetti's not your mayor at Venice? You have a different mayor, correct?
It's sad. I don't know who the mayor is.
So how do you feel UCLA has, how would you rate their response?
Even though I'm a UCLA employee, the clinic, we raise our own funds, and we give it to them, and they pay us, and we buy their insurance, and we buy this stuff. So we have a unique relationship. So technically I'm not UCLA, but I think the stuff that they have done has been really good, like the symptom tracker, and they have a COVID helpline and COVID specialists, and we've been able to ask them questions and talk to them. So I think, they've done a good job. I don't feel like they haven't done a good job.
Who sets the protocol for your clinic?
So right now, it would be the medical director and the associate medical directors, and this COO. So I'm the CMIO, so I'm more in charge of the electronic medical record and telehealth, and like and our mobile app, and like the technical stuff, like anything that we use, any technology that we use to work with the patients. That's what I do.
So how do you feel that coordinating effort was implemented between those entities that you just described?
I think it was good because our clinic is small enough to where we don't have a lot of bureaucracy. And it was pretty much like, March 17th said, okay, telephone visits are approved. And it was like, okay, Margarita, come up with a plan. And then I came up with the plan under a week, and then it just happened. It wasn't like, I don't have, just kind of like when I hear about my friends who work at other county or facilities where there's a lot of red tape. It was just like, we were able to just make changes, send emails and Zoom meetings and say, this is what's going to happen,
So what was the hardest change that you had to make under COVID?
I guess staying home, because or staying home more, not going places, and staying away from people, because people are very, people always want to be around other people. They always want to hug you, or they want to see you, and so that's, I think the hardest thing is just the social distance. And then I haven't been able to have medical students come to my clinic. And I did a lot of teaching of medical students and PA students, physician assistant students, and I have not had any since March. And I've had to cancel a lot of rotations that my students were gonna rotate with me. And so I don't do any of that teaching anymore. And that's been really hard too.
How do you think that impacts their education?
They're gonna have a gap, but like I had one of the residents call me and say she wanted to come to the clinic, and I'm like, are you gonna watch me on the phone all day? I was like, no, stay home, study. I was like telling her the goal of this time is for you to stay alive and be, when it's over, still be alive. I told her that's your goal. She goes, but I'm missing out on procedures, this and that. And I go, well, you gotta stay alive. That's what I told her, you gotta stay alive. Just, make it to the end.
What do you think should be, you're someone who is in the field, ground zero, but also affiliated with one of the most important medical schools in the country and I would say in the world. What can be done so that people aren't, how can we look differently at this situation so that someone like that student can still get something valuable out of this experience, this time, this moment that we're living in?
I guess it would be teaching students from the beginning how to do telehealth, telemedicine, how to take a history over the phone without seeing them, how to do a video visit, and I think that I graduated from residency in 2000, so I've already been a doctor for 20 years. So I think had I not had that 20 years of seeing patients, I don't know if it would have been as easy for me to just all of a sudden start talking to them on the phone and asking them the questions and doing the visit without seeing them. I think teaching them how to use telehealth and teaching, and really thinking about how much of what we do is really evidence-based and really important, how much of what we do in the face-to-face visit is really necessary. I guess just figuring that out. And, there's always tons of things they could study and videos and virtual patients and things they could do to prepare while they're waiting for this to be over.
Yeah, that's such great advice. So thinking about what you started talking about when we first were talking, you mentioned that you would go to the high school, was it Santa Monica High School, and host a teen clinic. So how do you think this closure of the clinic has impacted that population?
Well, the children, they are children. The kids are made to stay home, but they're not staying at home. That's what we're finding is most kids aren't staying home, right? Like if your mom and dad don't have to do telework, and you go to work, how are you sure that your high school student is staying home and doing all their video, classroom, and not going out and seeing their boyfriend or hanging out with their friends? But so I'm sure that there will be more pregnancies, unwanted pregnancies, because although I tried my best to reach out to them through the patient portal, and refill their birth control, you know, it has been hard to reach out to them, you know, and make sure that they're getting what they need.
So you're thinking like 9 months from now, or we were talking about that in my family, just across the board, you know, not just
Oh,
about,
I'm
you know.
sure, you know, I think, yeah, pretty sure.
So does your clinic provide abortions or referrals?
We provide referrals. I think because we're federally funded, we're not allowed to do abortions. So I send them to Planned Parenthood, and there's one in Santa Monica, and I send them to wherever, you know, I have a list of referrals. I talk to them about what what their options are. But I have had a and like I published my data, not in like a journal, but like at seminars or, you know, poster days. I have a very, very low pregnancy rate at the teen clinic. I mean, it would be like 1 to 2 kids a year max. So, but that's because we were there on the high school Tuesdays and Thursdays. They could walk in those days, and whenever we weren't there, the nurses would call us, and we gave them the birth control in their hand, and we gave them the emergency contraception. And, you know, so because I did all that, we didn't have a lot of pregnant kids. And because they knew it was confidential and they could come and see us, and it was during school and their parents wouldn't know that they left the classroom. So we had a very low pregnancy rate at the clinic, but it wasn't that way. I started there going to the teen clinic when my son was like, I think in preschool, and now he's graduated. So like 14 years ago, it was a lot higher, the pregnancy rate. But overall in the country, the pregnancy rate has gone down for teens.
Do they have a way to access the same service now that
Either by phone or video, or like a portal, which is like an email to me, and they'll email me and tell me, like yesterday I got an email home, kid, I need my birth control, you know, and I just refill it, tell them go to the pharmacy. So there's a way, they just have to reach out to me somehow.
And do you see them reaching out, or do you see a decline?
I think they can reach out to the clinic general line. So it's not everybody, but I do see that they are reaching out. I can see in their chart if they called or if they were seen by another provider or, you know, physician or so. I haven't done the statistics to see, but usually every year when the seniors graduate, we lose a lot of patients. They go to college and then they go elsewhere, but we still get them to call us.
I guess the time will tell what becomes of our teens right now. I know I have a 15-year-old and she doesn't leave the house. But that's because she's likes to stay home and she's kind of more of an introvert than an extrovert. So has anything related to, this will be my last question. We also want to think about the civil rights protests that have been taking place.
Yeah.
And has any of that impacted your life during this time?
Yeah, that makes me want to cry. It was really hard to watch George Floyd get murdered. I mean, that's really what we watched, was a murder. And when I think about it, it makes me cry. It makes me so angry. And not just angry to see that happen and it be okay, but angry at people's reactions to it, not caring. And then, you know, sorry.
That's okay. Take your time.
Yeah, no, that makes me really upset. I did, there was a Black Lives Matter protest at UCLA and the students had it, and I did leave my house for the first time for that. And I stood really far away from people, so I could barely hear what people were talking about, but I was just there because I wanted my students to see me, because I know it's really important for the Black and Latino students to see their attendings show up. And I did see one of my students who's, you know, she's Black, and you know, she passed by me and she goes, you know, I'm really glad you're here. I knew you would come. It's just really makes me angry.
Yeah.
And then to see the same thing happening, so many Black and Latino people dying from COVID, it's for the same reason. It's really upsetting.
Yeah, like you said, your job and the job of the students is to stay alive.
Yeah, that's really the thing, is to stay alive, because I don't I don't feel like there's any need to be like a superhero, or when we say that doctors are heroes, like I don't feel like I'm a hero. I have to go to work. If I don't go to work, then I won't have health insurance. I won't have a home, and I can't feed my kid. I don't go to work because I'm a hero. I go to work because I have to. And just like I've seen like farm workers working, they have no other choice. If they don't do it, someone else will take their job. Grocery store workers, they don't really have choices, and it's it's when I see the grocery store workers, I wish that they were all wearing face shields and surgical masks, because they're around so many people. And it's, people of color, are doing all the jobs that are the highest risk. And, they don't have access to testing, and they don't have access to health insurance, and they're the people dying. And it's all the same thing. It's all due to racism. And just as the police is a very racist institution, so is medicine. Medicine is a very racist institution. And, being a Latina physician, it's only 2% of physicians are Latina. So it's not like, I can recognize that I'm part of a racist, culture or medicine. And I try to do what I can to not have biases and to treat everybody the same. But I know that there are people that are doing the same, and it's very difficult to see, like, the pandemic just show a bright spotlight on the racism and the inequities.
Yeah, that's a really good point, because it is connected. That racism that took his life is the same racism that's taking the lives of how many thousands, hundreds of thousands of Latinos and Blacks right now, today, under this
Are
pandemic.
incarcerated or in detention centers or at high risk for COVID. And it's okay. It's okay if they die. It's okay. It's like, it's absolutely terrifying. And, I just wish people would understand. But I also understand that people are very social human beings, and that they're get very anxious and depressed and feel isolated, and they want to party and be around each other. And, I've even had people tell me, oh, COVID is just like the flu. And I'm like, no, it's not. It's very difficult. And I've even had people say, oh, if there's a COVID vaccine, I'm not going to get it. And I'm just like, oh, I don't know what we're going to do,
What do you think? I guess if you could talk to, well, you already mentioned your feelings towards the president, but if you could tell him, like, what advice would you give him?
People always ask me that when I interview, and I don't think he would give a rat's ass what a Mexican American thinks. Like to him, I'm trash. I'm not even worth looking at. So I wouldn't even waste my time. I think if I saw him, I would just be so terrified. I would run.
How about our governor?
I would just tell him to, just keep listening to the physicians and scientists, and, and not worry about his popularity, and just worry about trying to save as many people he can, and their jobs. I mean, and their livelihood, their housing. I mean, I feel for him. And then now with the fires, I'm like, oh God.
That's really great advice. That's great advice. Thank you so much. Is there anything that you'd like to tell me that I didn't ask? Anything come up for you that you want to share that didn't come up in my questions?
No.
So what's the first, okay, I did say that was my last question, but I do have one last question. What's the first thing you're going to do once, things clear up and it's safer to go outside?
No. I guess I don't have a good answer for that, because I feel like I don't know what is. I mean, I would love to say travel, or because I do love to travel. It would be nice to travel to go out of the country, you know. I wanted to go, my son wanted to go to Japan for his graduation, so I did want to go to Japan this year. So maybe that'll be it. I'll go to Japan if they let us go to their country.
So once it's safe to go to Japan, that's where that's your next flight. Yeah, that's wonderful. Yeah. Thank you so much, Margarita. I really appreciate you taking the time to talk to me. This is really powerful. I don't know if you can see my eyes, but you really said a lot of really heartfelt things that I know are going to be important when we think about these stories in the future.
All right. Thank you.
Take care. Have a great day.
Bye-bye.
Bye-bye.